Okay, so for this video, we're going to be talking about a little more of the specifics of the side gliding mechanism within the spine. So as a quick recap, this is featured in one of the other videos. You want to think about, like a circular motion here. So this is true throughout the spine, unless you're looking, intersegmentally of like the sacrum, which is kind of technically fused. But majority of the articulations within the spine, if you imagine, like if I'm turning my head, like this would be like my top of my head going the one way, my chin going the other, almost like I'm trying to crack my neck. And so imagine like rotation this direction, like it would be a relative side bend of my cervical spine. And you want to imagine that as that's coming down, this is coming across, that's coming down, that's coming across. So almost like you can imagine with these being like a box, right? So kind of here, a square, here, and then that's going up. So that and that be like turning a steering wheel, like so, okay? And so if you imagine like the vertebrae, this is a secondary motion, but a very important one. So say it's pain or pinching, like jamming up there, like either here or radiating down the arm or wherever it might be, or up into the head, even headache and that. There's a little nerve in here too, the suboccipital nerve, that could be getting pinched. That could also be problematic. So again, like my head is coming this way, my spine is going to actually shift over and glide in that general direction. So I don't necessarily need to force this, especially if it's painful or problematic. What I want to do is I want to be able to emphasize the side glide, because that's almost like a prerequisite to be able to safely, easily, and without pain or other symptoms get my head into the side bend. I can use my fingers. If I start in the rear and I come out to the sides, you'll feel there's a meaty part of the side of the neck here, and underneath that you should feel the transverse processes basically like sticking out from the sides of the vertebrae. And so you should feel that resistance there. And so try to get your fingers on each side, and almost like a tug of war, but in reverse. You're pushing in like two bulldozers or something, but again, very gentle here. We want to make sure, and then just allowing the head, not forcing the head into a side bend. You can maybe gently put a little overpressure, but again, I'm not trying to pull it down in this. I'm just maybe pushing it more over. So again, I'm kind of like this and allowing the head to roll into that. Now, you might be also able to use something like this, or if I kind of pull it sideways, make sure you're not choking yourself here. Something like that, okay? But again, don't choke yourself. And then the other component to this that makes it a little more complex, or two more components. This one is that the upper cervical works different than the lower, or mid and lower. So I'm talking like C1, C2, right by the skull. And at that area, it's more of a, when I side bend, I'm going to be rotating my head in the opposite direction. So my ear's coming down that way, but my head is turning that way. So if I'm more biasing upper cervical, it's like that. However, if I'm side bending this way, and I'm looking mid to lower cervical, I'm actually gonna be rotating my head that way. So there's a bias of front back here, okay? So depending on the rotation, if I'm gripping my spine, that's upper cervical, okay? And if I'm side bending and rotating that way, that's lower. So technically the rotation is in the opposite, or in the same direction as the side bend here, opposite up here. So that's where you might need to put a little bit of a spin. So again, more upper cervical, and that's where you might feel a limitation if it's tight, stiff there, and be like, oh yeah, that's kind of not moving really well. And then the other one is more, I'm side bending, but I'm also rotating that way. So it's more almost like you're looking down and across, like say towards your armpit or something like that. So that would be more mid to lower. Here, I'm side bending to that direction, and then I'm also rotating that way. So just something to consider and play around with, and just be careful if you have any kind of like surgical area in there, especially like a fusion, if there's hardware in there. Certainly if this is a recent surgery, you don't want to be messing around with that, but if it's something that's 6 months or more into Certainly after a year, be pretty well set, but just gentle. We're not trying, and you may also want to consider lying on your back with a pillow for head support or something, so that you don't feel like you're tensioning these muscles. You want to try to just really work just the bare minimum of the muscles, and really tend to make that really easy and natural, and not trying to like crack your neck or crank anything. Just trying to connect with your brain and your body and re-coordinate those muscles. There's a lot of little ones in there that can certainly be part of that. You can also, you can't see it in the frame here, but I'm kind of pushing on my ribs side to side, thinking about the ribs, and thinking about also, rotation, side bend kind of movements there in different ways. And I'll try to make another video on that one.